At Des Moines University Clinic, you'll find healthcare professionals with only one priority: you, the patient. Come see us for the very best in family medicine, physical therapy, podiatric medicine, and osteopathic manual medicine. Call today to schedule an appointment.
Hello everyone, my name is Mandy Hale. I'm a second year medical student, and I'm here today to talk to you about end-of-life decision making. We're going to be talking a little bit about different advanced directives that are available for you, as well as different ways to get your wishes for your end-of-life decisions out there and known. So without further ado, let's go ahead and get into it. So first, I just have some links here for the IPost. It stands for the Iowa Physician Orders for Scope of Treatment. And unfortunately, you can't click the links, but we have the document here. It's one page, front and back, and it's broken up into 4 sections. So the first is CPR, the second is medical interventions, the third is artificially administered nutrition, and the fourth is medical decision making. And I am but a lowly medical student, but I'm joined with Dr. O'Shea, who has much more experience talking about these forms, so I'll go ahead and turn it over to her.
All right, so thank you. So the IPost document has been in existence probably for about 10 years in the state of Iowa, and it's actually similar documents are available across the country. What I'd like to do is go to each box and just kind of enlighten you on what those mean. So in A, when you're thinking about CPR, cardiopulmonary resuscitation, this is when somebody is going to be giving you compressions on your chest. We usually don't do that until you've stopped breathing, and your heart has stopped. We check your pulse, we check your breathing first before we do any of that. What you need to know is, except in children, when you get to that point, there's a lot of things that's already wrong with your heart and lungs. So that doing CPR doesn't restore you back to the way you were when you were 20 or 25 years of age, like Mandy is. It doesn't even restore you to the way you were a month or 2 ago, but the way you were 20 minutes or 30 minutes or an hour ago. So you do need to realize CPR might bring your heart back to work, but it doesn't help with the illness that brought you to that situation. So let's move on to B. When we're talking about medical interventions, this person has a pulse, is breathing, but is in a situation where they are at the end of their life. So if you are in that situation and all you want is comfort measures, that's what to check. That doesn't mean we stop caring for you. We always care. But what we will do for you is to relieve your pain and suffering, but not do anything that is necessarily going to be uncomfortable for you. No life-sustaining treatments. If you had previously had cancer, this would mean not doing any additional chemotherapy that is curative. Anything that palliates and takes pain away would also be included under comfort measures. Now, the limited additional interventions, this is important to think about. If you would want something like IV antibiotics in case you got pneumonia, it's important to know that would be part of the limited interventions. They would also potentially give you medicines that might help your heart, short of doing more of full treatment. So that could be medicines like anything that would support your heart or support your breathing that's short of that. That may also include some respiratory support that is called BiPAP or CPAP that is even used now in COVID to support your respiratory symptoms and keep you away from the mechanical ventilation. Finally, full treatment includes everything we've already talked about, but that means you have the tube go down your throat. The cardioversion, the electrical stimulation of your heart would also be done. So you do need to understand what those mean. And if you have any questions, please talk to your primary care physician about it. The third one is about artificially administered nutrition. If you choose this is not a tube necessarily that goes down your throat through your nose. That usually is only done for a few days or hours, let's say if you had some stomach surgery. But we're talking more about what's called a gastrostomy tube, a tube that goes through the skin of your abdomen directly into your stomach. And there are times when a trial period of a tube is certainly warranted. I've had patients who've had some damage to their airway from an injury or an infection and needed 2 to 3 months of a tube. That's certainly indicated, and be thinking about that as you check that box. But most of the patients that I deal with have long-term artificial nutrition by tube. This might be a patient with a neurodegenerative disease like Lou Gehrig's disease or ALS, or it could be someone that had a stroke that affected their ability to swallow and they'll never be able to get that back. Those are the patients that have the long-term gastrostomy tube. Finally, we're moving to D. This is helping you to decide who is going to be your surrogate. If you are unconscious, unable to list who you want to make decisions for you, or if you are demented and the dementia is advanced enough you cannot speak for yourself. After you need to designate who would speak for you. Always the best person for that is going to be whoever you designate as your durable power of attorney. And that can be your spouse, but if your spouse is your same age and you're in your 80s, you may want to decide that one of your adult children or a sibling could be your durable power of attorney. Certainly, that's something to talk to a lawyer about. And then on the other side of D is the rationale for these orders. If this is acting as your advanced directives, that's great. If you know you have poor prognosis or limited treatment options and you want your healthcare providers, including the EMTs and paramedics that might be picking you up from your home if you're acutely ill, this is important to fill this out. And the reason why we have it in a bright color, a salmon color is what is suggested, is that you take your original of this and post it at your house somewhere. Usually I say hang it on the refrigerator. And when you look at the opposite page, the other person that needs to sign this, in order for this to be a valid medical order for the EMT, for the paramedic to follow all these directions, it does need to be signed by a healthcare professional. That's at the bottom of the other side. And I suggest you review it on a regular basis with your primary care physician and your durable power of attorney. You can always revise it, but it's a good idea to go just above the healthcare professional's signature and say, we reviewed it today, today's date is, and do that every 6 to 12 months. By the way, the people that can help you do this, it could be an MD or DO, it could be a PA or physician assistant, and it could be a nurse practitioner or an NP. Why don't you take it back, Mandy?
Excellent. So the next form that we're going to be talking about is the 5 wishes. So I've included some links here on how to find the 5 wishes document, but unfortunately, because this is a PowerPoint, you can't necessarily click them, but I've included some pictures of what the front cover looks like, as well as the pricing options for the 5 wishes advanced directive. So it's $5. There's an online PDF version which you fill out on your computer, or a physical paper copy that you can fill out on paper with a pen. It comes in, I believe, 29 different languages, and here at DMU we have, I think, 15 copies in English for y'all to have access to. We also have 2 Spanish copies if English isn't your first language. And I've also included a picture of the front cover. So the way that the 5 wishes operates is it's broken down into 5 different sections of your different end-of-life decision-making, like decisions, I guess. So the first wish is the person I want to make care decisions for me when I can't. The second wish is the kind of medical treatment I want or don't want. The third wish is how comfortable I want to be. The fourth wish is how I want people to treat me. And the fifth wish is what I want my loved ones to know. So where this one is really great is it doesn't just take into account like what medical procedures you want done. It also takes into account the more humanistic aspects of the dying process. So, how many people and who you want around you when you're dying. There's another option in there that's about like if you want oils rubbed on your body while you're dying, different music that you want to listen to as well. And I think it's just really phenomenal to have those more personal aspects of the dying process addressed when it normally isn't. Do you have anything else to add, Dr. O'Shea?
Sure. What I do want you to know is that numbers 1 and 2 are very similar to the IPost document, but you really should have both because the IPost document is a doctor's orders for other healthcare professionals to follow. But having the 5 wishes filled out also helps your family a lot to have a document that they can hold on to. And what I love about 3, 4, and 5 is it really expands, the booklet expands on what comfort wishes are. And number 4 talks about things that beyond just physical comfort, discussions you might want to be having with your family, as the physical touch, which we can still hear and we can still feel things even if we cannot communicate back to our loved ones. And finally, I think everyone should review number 5, which is things that you want your family, your loved ones to know, including receiving and giving forgiveness, to know how much you've loved them, things that you might want to share or have shared at your memorial service or funeral. So I wish you would embrace the 5 wishes. Of course, you can purchase them through either the booklet or online. But again, if we've got your name and email address and personal address, our limited copies, we have some limited copies, but we can certainly send them out.
Yeah, and I'll talk a little bit more about that towards the end of the PowerPoint. So now, as far as the advanced directives go, this is something which you need to meet with a healthcare provider about. For the durable power of attorney, you need to meet with a lawyer about. But I've included some links here, which unfortunately you can't click, to various documentations for the different advanced directives. Mercy One and any hospital have people that are available to help you fill out this paperwork, which I think is awesome. It's very empowering in order to fill out this paperwork and to have someone to help you with it because it can be very long and daunting. But yeah. And then here is just kind of some more information about the different advanced directives and the ones that Iowa law recognizes. Again, Mercy One is the one hospital that I was able to find a lot of information on, but any hospital will be able to help you with this documentation and to provide people to go through it with you. So the last little bit of our PowerPoint presentation is who you can go to if you have more questions. So of course, any primary care provider or any member of the healthcare team will be able to help you with these end-of-life decision-making forms or advanced directives. If you go to them and ask them questions, spouse, family, and friends are great people to talk to have your wishes known, because unless we don't talk about it, we'll never be able to quite know specifically what you want for your end-of-life process. And religious leaders can be a great source for what you want done to your body spiritually while you're dying, or if you have any questions about the dying process in a spiritual aspect. Do you have anything to add to that, Dr. O'Shea?
Okay, so the one thing I want you to know is every hospital since about 1995 will ask you about your advanced directives at the time of admission to the hospital. It's not necessarily because they believe that you might pass away during that time, but they are obligated to ask you as part of the Patient Self-Determination Act of the mid-1990s. So every hospital will do that, but don't wait till a hospitalization. Talk to your primary care provider earlier than that and make sure that not only do you have a copy of those physician orders, but make sure that your primary care provider has that, as well as the hospital that you would designate as the one you want to be taken to if you couldn't just speak for yourself.
Excellent. Thank you. And that concludes our presentation. I've included some references of different organizations that we've talked about today, and I also threw in the AARP link. They have awesome resources for end-of-life decision making, as well as just resources in general about the aging process. And finally, this is my email. If you have any desire to have any of these forms that we've talked about today, or if you have any more questions about end-of-life decision making, please don't hesitate to email me. If you're emailing to get an end-of-life decision making form, like the IPost or the 5 wishes, send me your home address or where you get mail regularly, and we can send that your way. Thank you so much for listening to our presentation. We really appreciate it. It's not easy to think about and talk about mortality, but we really appreciate you taking the time and being here with us today. Thank you.
At Des Moines University's Family Medicine Clinic, our goal is to provide you with compassionate care that is comprehensive. From caring for children to the elderly, our medical team provides holistic preventative guidance on how you and your family can maintain a healthy lifestyle and manage any symptoms that may arise so that you can be at your best. During the current COVID-19 pandemic, maintaining your health as well as a safe lifestyle has never been more important. Our providers are here to help when acute conditions affect you or your family. We treat musculoskeletal injuries, infections, illnesses, and many other medical conditions. As an academic medical center, DMU is training tomorrow's healthcare providers on how to provide expert care to people from all backgrounds. We invite you to visit the Family Medicine Clinic at Des Moines University. We offer the care and attention you deserve.